Hey guys, my name is Ethel and welcome to my diary. Today I will be talking about self-medication. Self-medication is taking pills for any ailment without a doctor's prescription. Are you guilty? If you are, then sit back and listen to this. A lot of people actually misuse a lot of drugs like pain relievers such as opioids, antibiotics, stimulants, antacids, anti-diarrhea, vitamins, and so on. But today I will be concentrating only on antibiotics because I just want to make this video very, very short. I will still touch on other ones, but not today. So guys, let's talk about antibiotics. What is antibiotics? Antibiotics are medications that target and destroys or slows down the growth of bacteria. If you are this kind of person who likes to self-medicate, how would you know if your ailment is of bacterial origin or viral origin or another? There is no how you will know. And listen, we have different groups of antibiotics. How would you even know which one you will take? And let's assume you know that your problem is of bacterial origin. How would you know the type of bacteria? There are different types of bacteria. How will you know? There is no how you will know except if you go visit the hospital, run a test, and they will be able to find out the type of bacteria and the type of and the group of antibiotics that can be able to target and destroy that bacteria. Now, I've seen so many people in Nigeria taking antibiotics every now and then because they have warts, sore throat, because they have common cold or flu. You see guys, if you have common cold or maybe you have flu or sore throat or bronchitis and so on, most times these things are of viral origin. No matter how much or how many times you take antibiotics, it is not going to have any positive effect. It's never gonna help cure you of that certain ailment. It will not. Antibiotics has no effect on viruses, and flu is of viral origin and not of bacterial origin. Common cold is of viral origin and not of bacterial origin. You see, bronchitis mostly of viral origin, not of bacterial origin, and so on and so forth. So how would you know? It is actually very impossible. When you go to the hospital and you run a test, let's assume that you have a bacterial infection. Like for instance, the person has a urinary tract infection and you happen to be this type of person who doesn't self-medicate, and you go to the hospital. The best thing that they have to do is to give you an antibiotics, prescribe an antibiotics for you, and that is going to be very effective because that one is of bacterial origin. And something like pneumonia also, when you go to the hospital and they diagnose you of pneumonia, it will be very, very, very effective when a doctor finds out that your pneumonia is of bacterial origin and prescribes antibiotics for you. You will see a tremendous effect. You will see a positive change, and you will get healed very fast. But you see, most ailments that are caused by bacteria, no matter how much you take antibiotics, it is not going to have any positive effect. Instead, it will start having a negative effect on you long term. I will have to be very blunt to you, and I have to tell you that it is very, very wrong to self-medicate. You don't even know the normal dosage for that antibiotics. You don't even know the group of the antibiotic that you should take for a certain bacterial infection, and so on, guys. And you know, there are some risk factors, like not even so many risk factors, guys. Misuse of antibiotics can actually increase the risk of you getting an antibiotic resistant infection later. And what is antibiotic resistant? If you know what that means, you will be so eager to quit self-medication. Antibiotic resistance is when a bacteria can no longer be killed by antibiotics usually used to kill them. Guys, not only that, antibiotics not only targets and kills the bad bacteria, it also kills the good bacteria. And when I mean the good bacteria, I mean the body's good bacteria. Okay, let me even deviate a little and talk about drug misuse. When you hear about drug misuse, it means skipping your dosage, taking pills without any doctor's prescription, not completing your dosage. Like when you feel you're already getting better, you feel like, oh, let me just forget about the rest, I'm already fine. Then taking maybe somebody else's medication because you feel like it can work for you, and so on. Finally, guys, how do you take antibiotics? To take antibiotics safely, you will have to abide by these rules I'm about to list now. Number one, you have to take them exactly as your physician has prescribed. Number two, don't skip doses. Number three, even if you start feeling fine along the line, if you feel like you're already feeling better along the line, make sure that you complete the prescription. Make sure you finish it. Again, do not keep your antibiotics for later use. Lastly, do not take from anyone or give to anyone, because that is self-medication. So guys, we've come to the end of today's video. Thank you so much for staying with me till the end. And if you haven't subscribed to my channel, please just click on that red subscribe button down there, and also click on that post notification bell so that once I drop another video, you will be the first to get notified. Please. Thank you. So love you guys. See you next time.